Various studies on the response to HIV and AIDS that have been conducted in Uganda indicate that people living with HIV are discriminated and laid off at their places of employment. In a 2013 report by the National Forum of People Living with HIV Networks in Uganda, NAFUFANU, statistics indicate that up to 23% people in 18 districts lost their jobs due to their HIV status. This is against inherent rights as enshrined in Chapter 4 of Uganda's Constitution, as well as statutory laws like the Employment Act and the HIV Prevention and Control Act, as well as the Equal Opportunities Act.
And with knowledge that actually what they are doing is wrong. But with impunity, they will still go ahead and shamefully violate people's rights without remorse or without due consideration of what they feel or how the actions of these employers will impact the lives that we are talking about.
Earlier on this year, a number of employees of China Communications and Construction Company were terminated after they were found to be HIV positive. These two, a contracted male driver and a female cleaner, had worked for CCCC for about 3 years. They told NTV that they were subjected to compulsory HIV testing, which floats provisions of the HIV Prevention and Control Act.
They told us to have an HIV test, but I declined, but they said that if I decline, I would lose my job.
Then he told me, yeah, you're not going to work with us anymore. By then I was so scared and disappointed.
But even after complying to the demands of their Chinese employers, they still lost their jobs. They were humiliated and left to suffer at the hands of biting unemployment.
It has affected even my family, my wife, and also my kids as well.
I was ashamed because all children were looking at me that this one now is HIV positive.
China Communications and Construction Company is not the only implicated company. An investigation commissioned by Uganda Network on Law, Ethics and HIV and AIDS, Uganet, indicates a number of other companies involved in this kind of discrimination.
The rights of these people have been violated, and being the nature of investigation, 25 points to a large broader number. If you could only get a few voices in a given period of time, then it means that for all the 5-6 years these projects have been running, then this has been the practice. Because in particular, these violations happened in 2016, but could only be read and a few early this year. So you can imagine these companies have been in business, but this had not come out.
Sino Hydro Corporation, the lead contractor on the Karuma hydroelectricity power project, has previously sacked employees on the same grounds. This was also the case with labor exporting companies, including Middle East Consultants, Maghreb Agencies, International Employment Linkages, and St. Augustine University Department of Jobs Abroad. The investigation also indicates that a number of health facilities were used to carry out the tests against the consent of the employees. Doctors Hospital in Seguku is amongst those accused of this illegal practice. It is also alleged that the facilities did not offer counseling to the workers before the HIV tests were conducted as required by law. We spoke to the medical officer at the hospital who denied the allegations.
The commonest tests that we usually subject them to are probably, if you wanted to find out if they got injuries related to their bones, you do x-rays. You rarely take off blood samples unless you really think it is necessary.
He says there is no binding understanding with CCCC to provide medical services to its employees.
But because of their convenience, they prefer to come to Doctors Hospital Seguku. And usually, when they come in, they usually come in with injuries sustained at work.
A study carried out in 2013 by NAFUFANU also shows that the income levels of people living with HIV and AIDS in this country are generally low, with about 60% of them earning less than 250,000 shillings a month. Irrespective of their income levels, this group has high incidences of poverty.
I lost the job and all what I was earning. So I'm just living on handouts and doing odd jobs.
We tried to reach out to CCCC for a comment, but our efforts were in vain. However, in the confidential report obtained by NTV, managers of CCCC claim most allegations are false and they were not aware about the HIV tests and terminations. However, the director at Middle East Consultants says that tests are a prerequisite from the employing countries abroad.
So that is their policy. We as Uganda, as the Ministry of Labour here, or as we recruitment agents, we can't change their policy. Once they arrive their side, before even they take a glass of water, they must go for a medical checkup. Once they found you are positive, they must give us a penalty and they bring you back here.
The executive director at Uganet, Dora Chichoncho, urges the government and related authorities contracting these companies to ensure there is compliance with the law.
It is bad, and we want to say that all forms of violation on anybody whatsoever should not be taken as a simple thing. These companies, these firms should be brought to account.
Uganda currently has about 1.5 million people living with HIV. Despite the numerous campaigns to have people test and treat, stigma prevents individuals from getting tested for HIV, seeking medical care, disclosing diagnosis, and in adhering to treatment and follow-up. It is a life of despair for those who have been sacked and denied a source of living. Scarred by the stigma, many melt away from the prying eyes of the public and live in isolation, awaiting their fate. Walter Mwesigye, NTV.